Today we're looking at the x-rays of a patient who woke up with a locked up neck. He couldn't turn his head without extreme pain. Pain pills weren't helping either, and he couldn't go to work due to the neck pain. That's when he made an appointment to see if we could help. If you look at the normal x-rays, we should have a smooth forward curve, but this patient's neck is straight and his head is forward, meaning his posture is not correct, which puts additional stress on his neck and upper back. The neck usually gets straightened after an injury like a car accident or after having postural issues for years. This is his third visit, and he's already had great results.
All right, that's a good one there. All right, I'm gonna have you take a deep breath in and have you let it out. I'm gonna have you look up at the wall in front of you. Just look up. All right, awesome. Another one right here, don't move. Awesome. And I'm gonna check your low back. All right, we'll lay this side up here, facing me. Long day today?
Yeah. Oh man, that's about how every day is. It's just extra long.
All right, that was good. Let's have you lay on your back here. Face up. So, let's check here. Remember, it was that lower neck. We had that spot. So right here, okay. Here, look to the left. Okay, good. There's one up top here, look to the right. All right. And stay with that. Let's come on up. All right, we're all set.